Hi everybody, my name is Matt Sorrell. In this video, I will be discussing the question, does vitamin D supplementation treat respiratory infections? In order to help answer this question, it is necessary to first understand what vitamin D is, how it is synthesized, sources of vitamin D, and vitamin D deficiency, symptoms, and causes. Also, it is important to understand what a respiratory infection is, its symptoms, and factors that influence infection. Lastly, I will draw conclusions based on evidence I've collected from 3 research articles and make recommendations based on such conclusions. Vitamin D synthesis is the process by which the body produces vitamin D. The body can synthesize vitamin D naturally when the skin is exposed to sunlight or through the consumption of certain foods and supplements. The process of vitamin D synthesis begins when a form of cholesterol present in the skin, called 7-dehydrocholesterol, absorbs ultraviolet B radiation from sunlight. This triggers a chemical reaction that converts 7-dehydrocholesterol into a pre-vitamin D3 molecule. This pre-vitamin D3 then undergoes a thermal isomerization reaction within the skin, which transforms it into vitamin D3. Vitamin D3 is then transported to the liver and kidneys, where it is converted into its active form, calcitriol. Calcitriol plays a critical role in regulating calcium and phosphorus levels in the body, which are essential for maintaining healthy bones, teeth, and muscles. It is important to note that excessive exposure to ultraviolet B radiation can be harmful and increase the risk of skin cancer. Therefore, it's recommended to get vitamin D from a balanced diet and/or supplements and to limit unprotected sun exposure during peak UV hours. Vitamin D absorption occurs mainly in the small intestine, specifically in the duodenum and jejunum. The process of absorption is aided by bile acids and pancreatic enzymes, which help to break down and absorb the vitamin D from food or supplements. Once vitamin D is absorbed, it is transported to the liver, where it is converted into the 25-hydroxy vitamin D3 during a process called hydroxylation. A second hydroxylation occurs in the kidney, in which 1,25-dihydroxy vitamin D3 is produced as the active form of the vitamin. Vitamin D is produced naturally by the body when the skin is exposed to sunlight. However, there are also several food sources of vitamin D, including egg yolk, salmon, milk, soy milk, and yogurt. It's important to note that it can be difficult to get enough vitamin D through diet alone, so many people may need to take a supplement or spend more time in the sun to maintain adequate levels. The recommended dietary allowance for vitamin D varies depending on age, sex, and pregnancy lactation status. The following are the RDAs for vitamin D according to the National Institutes of Health. Infants age 0 to 12 months are recommended to consume 4,000 to 1,000 IUs per day. Children age 1 to 18 years are recommended to consume 600 to 1,000 IUs per day. Adults age 19 to 70 are recommended to consume 600 to 800 IUs per day. Adults over 70 years of age are recommended to consume 800 to 1,000 IUs per day. If you are pregnant or lactating, you are recommended to consume 600 to 800 IUs per day. It's important to note that these recommendations are for individuals who get little or no vitamin D from sunlight exposure. Some of vitamin D's functions include promoting bone health. Vitamin D helps the body absorb calcium and phosphorus, which are essential for building and maintaining strong bones. Vitamin D is also involved in the regulation of immune cells, which help protect the body against infections and disease. Vitamin D may play a role in the regulation of mood and the prevention of depression. Vitamin D has been shown to have anti-inflammatory effects, which may help reduce the risk of chronic diseases such as heart disease and cancer. Vitamin D is important for muscle strength and coordination and may help reduce the risk of falls in older adults. Vitamin D plays a role in the regulation of cell growth and differentiation, which may have implications for the prevention of cancer. Vitamin D deficiency is a condition that occurs when a person does not get enough vitamin D from their diet or exposure to sunlight. Some of the common causes of vitamin D deficiency include lack of sunlight exposure. Vitamin D is produced by the body when the skin is exposed to sunlight. People who spend most of their time indoors or who live in regions with little sunlight are at risk of developing vitamin D deficiency. Another cause may be inadequate dietary intake. Vitamin D is found in fatty fish, egg yolks, and fortified dairy products. If a person does not consume enough of these foods, they may be at risk of the vitamin D deficiency. Another risk includes certain medical conditions, such as Crohn's disease, celiac disease, and liver disease, which can affect the body's ability to absorb vitamin D. Also, people who are obese may be at risk of vitamin D deficiency because the vitamin can become trapped in fat tissue and not be readily available for use in the body. Also, as people age, their skin becomes less efficient at producing vitamin D, and their kidneys may also be less effective at converting vitamin D into its active form. Symptoms of vitamin D deficiency can include fatigue, muscle weakness, bone pain, and increased risk of fractures. Treatment for vitamin D deficiency typically involves increasing vitamin D intake through diet, supplements, or sunlight exposure. However, it is important to speak with a healthcare provider to determine the appropriate treatment plan for an individual's specific needs. A respiratory infection is an infection that affects the respiratory system, which includes the lungs, throat, sinuses, and nasal passages. It can be caused by a variety of different pathogens, such as bacteria, viruses, or fungi. The symptoms of a respiratory infection vary depending on the specific type of infection, but they can include coughing, fever, chest congestion, shortness of breath, and difficulty breathing. Respiratory infections can be contagious and can spread from person to person through respiratory droplets when an infected person coughs or sneezes. Examples of respiratory infections include the common cold, flu, pneumonia, bronchitis, and tuberculosis. For the past 3 years, the world has been in pandemic due to the COVID-19 virus that has exceeded 1 million deaths. The COVID-19 virus causes a respiratory infection that may cause cough, shortness of breath, sore throat, and congestion or runny nose, among other symptoms that may include fever, fatigue, and nausea. The symptoms described may become severe if not treated, which may become fatal. Even though the most current cases of respiratory infection have been due to COVID-19, other respiratory infections like the common cold, pneumonia, and tuberculosis are prevalent. In 2016, the leading cause of worldwide morbidity and mortality was due to lower respiratory infections. Interventions to improve air pollution and increase antibiotic use has lessened the morbidity and mortality of respiratory infections. An explosion of research has suggested the effectiveness of vitamin D in treating respiratory infections such as COVID-19 and tuberculosis. Fortunately, with the creation and administration of the COVID-19 vaccine, deaths and severity of the respiratory infection has decreased. However, if there were to be another pandemic caused by a respiratory infection, could we supplement vitamin D to treat and avoid another catastrophic event? This question I have is inspired by my own supplementation with vitamin D. I am from the Northeast and was previously diagnosed with a vitamin D deficiency, possibly due to the lack of sun exposure we received during the winter months. At that time, I remember getting many respiratory infections in the winter months and missing school because of it. Now with the recent pandemic, my interest has been sparked. A study published in 2017 studied the effects of high-dose versus standard-dose wintertime vitamin D supplementation on viral upper respiratory tract infections in young, healthy children. The central goal of this study was to assess whether high-dose vitamin D supplementation lowered the occurrence of upper respiratory tract infections in young children during winter months in comparison to a standard dose of vitamin D. A randomized human clinical study design was used. The high-dose group consisted of 349 randomly selected participants who received 2,000 IUs of vitamin D supplementation orally per day. The standard dose group consisted of 354 randomly selected participants who received 400 IUs of vitamin D supplementation orally per day. Parent-collected nasal swabs determined the number of viral upper respiratory tract infections between September and May. Although vitamin D levels in the blood for the high-dose group was on average 11.9 nanograms per milliliter higher than the standard dose group, there was found to be no statistically significant differences between the two groups when it came to the number of upper respiratory infections in the median time to the first infection. A high dose of the vitamin D supplementation did not lower the occurrence of upper respiratory tract infections among healthy children during the winter months. A study published in 2022 studied the association of vitamin D status with COVID-19 disease severity in pediatric patients. The central goal of this study was to assess the relationship between vitamin D levels in the blood and COVID-19 severity. A retrospective observational study was performed. Reverse transcription polymerase chain reaction testing was used to determine the date of a patient's COVID-19 diagnosis. Patients were assigned to Group 1 if their serum vitamin D levels were lower than 20 nanograms per milliliter, and the patients who were assigned to Group 2 if they had serum vitamin D concentration equal to or greater than 20 nanograms per milliliter. Of the 144 patients enrolled in the study, the patients in Group 1 had lower levels of vitamin D, calcium, and lymphocytes. Symptoms from COVID-19 Group 1 consisted of a higher dry cough, radiographic findings, fever, respiratory rate, and a longer duration of stay at the hospital when compared to Group 2. The higher serum concentration of vitamin D in Group 2 also had higher levels of calcium, lymphocytes, and neutrophils. Serum vitamin D concentration may be associated with the severity of COVID-19. A study published in 2021 studied the effects of a 2-week 5,000 IU versus 1,000 IU vitamin D3 supplementation on the recovery of symptoms in patients with mild to moderate COVID-19. The central goal of the study was to assess whether 5,000 IU of vitamin D supplementation taken orally every day is more effective than a 1000 IU vitamin D in aiding the recovery of mild to moderate COVID-19 symptoms for those with lower serum vitamin D levels. A randomized clinical trial was performed. 69 COVID-19 positive adults were hospitalized and were assigned into two groups. Group 1 consists of 36 patients who each received 5,000 IU oral vitamin D3 daily for 2 weeks. Group 2 consisted of 33 patients who each received 1,000 IU oral vitamin D3 daily for 2 weeks. Blood samples were taken pre and post supplementation, and COVID-19 symptoms were recorded when the patient was admitted and observed until full recovery. Patients taking 5,000 IU vitamin D3 every day for 2 weeks were the only group to have significant increase in serum vitamin D concentration. The 5,000 IU group took less days to recover, and their coughing resolved sooner than the 1,000 IU group. Vitamin D3 supplementation for a short period of time in individuals with lower vitamin D levels may reduce recovery time for COVID-19 patients. In conclusion, vitamin D supplementation may be effective in treating COVID-19 patients to reduce severity of the disease and duration of stay in the hospital. However, vitamin D levels above normal levels may add no extra benefits in treating other respiratory infections. Because the novel COVID-19 virus is so new, more research is necessary to provide causation. Based on my own research, course experience, and my own personal experience, I would advise most individuals to get 30 minutes of sunlight per day to boost vitamin D synthesis. In addition, eat a well-balanced diet consisting of 2 cups of fruit, 2.5 cups of vegetable, 3 cups of dairy, and a protein source high in vitamin D like fish. And if you live in higher latitude, take a vitamin D3 supplement in the winter months to make up for the lack of vitamin D synthesis from the sun. That concludes the video. Thank you for watching.